birds, very quickly. We almost finished, don't worry. And because here there are a few things that are, we already spoke about them for the other species. So fracture in a bird, again, what you need to do is try to restrain your bird, depending how big is your bird. If it's a budgie, or if it's a chicken, a duck, or even bigger. But the most important things that you need to do in this case is to avoid that the fracture and the wounds at the level of the fracture can deteriorate more and become worse. So you can, if it's, for example, the budgie is in a very big aviary, you can move in a smaller one to restrain him and contain him. You can put some towels and do like a donut where he can literally sit like a nest and he can sit in. But try to avoid the use of the leg. Again, don't try to put any bandage around if you are not qualified to, just because if you put like once a rubber budgie with tape all around the leg, the problem was that the tape was very stuck to the skin. So removing the tape in that case was very dangerous. Then we, after careful, a lot of time and very carefully, we removed the tape, but the risk was to literally make the lesion open or worse than it was already. Voice loss. This doesn't sound a proper emergency, but potentially it is, because if your African grey, like in this case, suddenly stop to speak as usual, he literally lost his voice. Again, could be something behavioral, because, oh no, I don't want to say anything today. I don't have anything to tell you today. Quite unusual for a parrot that literally his aim in his life is to make you deaf, possibly. Or in the other case, could be something affecting his voice box. And one of the diseases that can affect the voice box is aspergillosis. This is a chronic problem, but can appear sometimes suddenly with the fact that the parrots start to be less active, not very prone to flight, or not speaking at all. So if your parrot, again, is mainly involved African grey, but can affect also any other birds, if your bird stops to speak, don't consider that like because he's lazy. Okay, it's something that's required to be seen again as soon as possible. Okay, open wounds. Parrots, still speaking about parrots, sometimes they can preen themselves, sometimes they can preen each other, sometimes they can be a little bit more naughty, or could be also because if you try to reintroduce and bond two new parrots, sometimes they can fight one each other. I mean, most of you probably experience the bonding of rabbits. It's the same for parrots. So if you put two parrots straight away together, the first thing that could happen is they can fight, they can bite each other, and the beak of a parrot is very sharp and strong. So in this case, this one has been quite lucky because the wound was just superficial, but sometimes could be very, very deep. So first of all, the first things to do is try to avoid this type of situation. Secondly, again, here you can keep clean. Try to, with like a cotton bud, wet with some warm water, try to clean. If there is a bleeding, you can stop and make a gentle compression. And then obviously cover the wound, go to the vet. Don't apply any hydrogen peroxide, any iodine, or any ointment, because it can be worse and can affect also the assessment for the vet. Because, say, in this case, probably, yes, he needs an ointment, but we need to also decide which one is more appropriate for this type of wound. He probably wants to take a sample, or you want to see how deep is the wound. So don't try to do too much. The essential is literally just to cover the wound and protect the wound from any further contamination. Feather plucking, again, is something that possibly is not a proper emergency, because if you consider that this macaw has been in this situation for years, but the feather plucking like especially when it reach this stage, can open the doors to a lot of problems. So means that if you see that your parrot start to pluck his feathers, it's not just preening, but start to pluck, don't wait that he reached this stage, because this is a very no return point. Okay, so also if it's something that doesn't look very concerning, from my point of view, is something that require to take an action as soon as possible. You can try to distract your parrot, you can try to enrich his environment, you can try to, especially when there are no open wounds, so if there is anything that you need to stop bleeding or wash or do anything else, but already try to make the environment more rich. Could be probably because he's bored, or is because he starts to obviously develop this type of behavior. And as the stasis in rabbits, feather plucking in parrots can be caused by several things. Then we are here back to the impacted crop. So when it's not just a little bit, but is, as you can see in this chicken, was a massive crop. It was like probably the size of an orange. And it's also called sore crop, is something that reach this stage. You can, yes, try to massage, you can try to change, offer a little bit of water, because most of the time this situation is caused by the lack of water, because it wasn't available enough water or in the right place, or because there was a competition with different chickens and the dominant ones wasn't allow this one to go to drink. But it doesn't matter what caused the problem at the beginning. At this stage, the most important thing is try to absolutely relieve this chicken from the pain, the discomfort, to have a very sore crop, and avoid that the food in the crop can cause any further infection. Sometimes there are parasites that they can cause this, but again, the first thing is try to put the chicken in the best situation to try to remove the content of the crop. Sometimes can be made manually, sometimes require anesthesia, because again, when it's too much, it's not something that you can literally try to remove and squeeze the crop. Don't do this, because first you can cause also abingestis, means if the content of the crop is quite liquid, pushing it up can also make this closer to the first airway, so the chicken can literally aspirate the content and then develop an abingestis. So when the food or the material is going the first airways. What can help with the sore crop? You can try to make a gentle massage at the beginning, but again, if you feel that it's too hard, don't do anything. Eye trauma, same approach that we saw for the guinea pigs or the rabbits. You can try to flush, keep the eye clean, but also in this case required a proper assessment to see how severe is the problem and how deep is the damage. Egg retention cloacal prolapse. As we saw for the tortoise, the prolapse of the cloaca can be related most of the time with an egg bound. So you should avoid to squeeze the belly or cause any trauma. Don't try to push the egg outside. Put your bird in the best condition and then go to the vet. Excess of urates sometimes can be related with the diet, sometimes with intoxication. So if the parrot or chicken ate something that he shouldn't, like in this case was like some teeny tiny piece of metal. If you notice anything like this, again, you can collect a sample, you can obviously bring with you, but again, is something that requires further investigation. There isn't too much that you can do. If at least don't ignore it, try to bring to the vets that will be able to help you much more. Increase respiratory effort, mouth open. The first thing is try to avoid Teflon, smoke, or anything else that can cause this problem. If it's like a irritant agent or something that can cause respiratory distress, the advice, as we saw for the snake, for example, is to keep the nostril clean, try to remove any saliva or excess saliva or secretion that is in the beak, and then put in a warm place, because they can become hypothermic very quickly. And especially smaller is the bird, faster could be the hypothermia. So you need to keep warmer. Doesn't matter a very big, don't arrive to the practice with a big cage. It's, again, the box should be also quite small because you need to contain and make the journey less stressful as possible. Dogs, fox bites, this could happen with waterfowl or any other birds that's like backyard birds that's living outside. In this case, you can flush, keep the wound clean, and cover the wound. Don't try to, I don't know, stitch up. Again, put the cream or the ointment or or any other disinfectant, because if there is any communication with the chest, the thorax, or internal organs, can be worse. So you need just to cover this. Duck arrived to the hospital, wrap in a towel. The owner literally flushed with tap water, and that he like just a little bit warm, flush the wound, and he literally wrapped in this giant towel and put in a box, restrain in the way that he wasn't able to flap the wings or do any unnecessary movement, and come to us. Once arrived to the practice, we put under the oxygen because she was very stressed. And once stable, we start to clean the wound and try to fix the problem. But the fact that the owner already kept the wounds clean was a very massive help for us. Pododermatitis, this can become, again, quite a chronic problem. It's quite a chronic problem. So if you can identify it at the right time or prevent it, much better, can avoid this type of lesion. These two on the bottom are the grade 4 and 5 of pododermatitis, so the worst situation that you can have with pododermatitis with an open wound. What you need to do in this case? In the worst case scenario, you can flush, protect. As you can see, the tiny scab on top was also covered in feces, so it's the best place to infection to thrive, bacteria to thrive. So you need to flush, remove, don't pull the wounds. In this case, this has been done at the practice, but they already try to clean and keep the wounds protected. If it's active bleeding, you can stop the bleeding, make a gentle compression, and then come to us. If instead you see that the is still not too bad, but you can see that is not normal, still come to your vet. Your vet can probably instruct you how to change something in the husbandry, probably because in this case the duck was literally in a concrete surface, so too hard and harsh for the feet. But can help you to tailor some like socks or shoes or something that can prevent this problem. If this wound is still not bleeding, there isn't really too much that you can do. You can flush, you can put some, like if you want a sock or something to protect the wound, mainly to avoid any further discomfort for the bird. But then come to the vet, or in the meantime, you can send a picture and ask some advice if your bird cannot be seen sooner. But again, it's not an emergency, but a proper emergency, this one, but can open the doors to, like how you can see to the other two picture, something that is definitely more severe. And in this case, the tendon, ligaments, muscle can be affected. So again, don't wait that you reach this stage. So if you have a bird, sometimes if it's well trained, you can try to check and have a look underneath to avoid this. And again, when stabilized, when put in the right situation to be moved, you can go to the vet. Put always in the safest place and in the safest carrier. Also, bear in mind that when you will arrive at the practice, there will be other patients. There will be dogs, cats, other people. So my ideal waiting room is a very calm and zen place where no one is barking or noise or that. Is not like this. So sometimes could be a little bit noisy because there are dogs that never saw each other, so they can start to speak each other quite loudly. So if you arrive with a bird, this could be quite distressful. So also if the vet already know that you are, or any of the other animals that we saw this evening already knows that you are arriving, probably can let you come in from the rear door or give you access straight to the consult room, or if they cannot, they can bring your animal, bring to the back, stabilize, and then come back to you and ask you some information and obviously telling you what is happening and which are the next step. Don't arrive to the practice with the bird, like the parrot on your shoulder, or your rabbit in your hands, between your arms, if it's not well restrained, because again, the risk is as soon as you enter the practice, the dog is barking, or there is other noise that can stress much more your animal. So in conclusion, I'll briefly recap. So some of these emergencies require a proper intervention. We saw, so there is something that can wait, but others need a very quick and briefly stabilization and then go to the vet. You need to assess the situation, and most important, you don't need to panic, because the panic is your best enemy in this situation. Oh, it's bleeding, you start to run up and down the house without doing anything. Okay, I know that is your animal, so it's stressful, but it's stressful for you as for them. So, and the first and most important thing is to don't harm them. Means, as I said several times, don't try to apply iodine or anything else that can make the wound worse, or put like cream or give medication if you are not, I say qualified, but you don't know if they are the right one or not. So it's better to potentially wait until you are to the vet. So first, what you need to do, you need, as we say several times again, is put them in the best condition to avoid that the situation can become worse. So you need to restrain them, a towel, a blanket, anything to wrap them, or a box. Avoid cage in this case, because if the bird is flapping his wing, it can, obviously the wings can be stuck in the between the bars of the cage. And everything should be done in the quietest and calmest way. Again, don't panic, because it can make your animal more agitated, more stressed. And once you have the control of the situation and you know what is happening, then you can contact the vet, tell them what is happening. And you need to ensure also your own safety. So don't think also just about your animal, but you need to also think of yourself. So don't try to restrain your parrot that is panicking itself with your hands, because he will try to bite you, and or even worse, obviously can escape. You can stop an hemorrhage. As we say, you can do a gentle compression in the meantime that obviously you're doing all the other stuff. You can flush the wound. You need to protect the wounds and maintain the airways clean. Blood, any fluids discharge, keep the airways clean and keep warm. Don't too much, okay? Don't provide too much heat, but the right amount of it, because especially reptiles, but all the other small exotics fairies and feathers can become hypothermic, so they can lose their body temperature quite quickly. And what not to do is waste time and ask for help on Facebook, neighbor, and I saw, oh, so what I need to do? Oh, no, but I need to do this. Oh, but, oh, well, which is your experience? Again, every patient, every animal, every patient is different. So many people can tell you, oh, yeah, in my case, I done this, this, and this, but could be completely different from your one, okay? Don't apply ointment. I already told them so many times, but hopefully this will be clear enough. And don't use any aggressive disinfectants.